So hopefully you can all see my slides.
Yeah.
Yes. Okay, that's great. So welcome everyone. Today I'm going to present a little bit on Fast Track Cities Plus, and Dawn's also going to help me out with some of the presenting. So just to introduce myself first, I'm Lottie Drury. I'm a Public Health Senior Officer in the adults team within the Public Health Division. I've been working at the Council for about 1.5 years now, helping out with the Sexual Health Commissioning and leading on the Fast Track Cities initiative. If I just get Dawn to introduce herself as well.
Hello, I'm Dawn Hannigan. I'm a programme officer on secondment into the adults team. I've been there for a couple of months now, so still in learning mode, but it's all good. And helping Lottie today with this presentation.
Thanks, Dawn. And we've also got Juliet who's going to monitor the chat. So if you've got any questions, you can pop them in there. And we've also got Sarah on the call who's worked in HIV and Hep C for quite a while. So if I struggle with any questions, hopefully she might be able to come in and help me out. Yeah, so to introduce this presentation, it's on the Fast Track Cities initiative, which some of you might have never heard of before, but hopefully you'll know what it is by the end of this. And this is very fitting because Fast Track Cities is an initiative that aims to eliminate HIV. And this week, in case you're not aware, is HIV testing week. So what we're going to cover today, I'm going to tell you a bit about what Fast Track Cities Plus is. We're going to do a quiz about HIV, Hep B and Hep C and TB. So if you get Mentimeter at the ready for that. I'm going to give some statistics in Birmingham about these infections. We're going to share some people's stories, talk a bit about how to prevent these infections and also how to get tested for them. So what is Fast Track Cities? Well, the Fast Track Cities initiative was launched in 2014 as a worldwide drive towards ending HIV. It's a partnership between a network of cities. So some of the other UK cities include Bristol, Cardiff and Manchester, but they're cities from across the world that have signed up. IAPAC, which is the International Association of Providers of Acquired Immune Deficiency Syndrome. The UN AIDS, which is the Joint United Nations Programme on HIV and AIDS. The UN Habitat and the City of Paris. So cities join the initiative by signing the Paris Declaration, which commits them to achieving the 95, 95, 95 targets. So these are 95% of people living with HIV know their HIV status, 95% of people diagnosed with HIV being on HIV treatment, and 95% of people living with HIV who are on treatment to have a suppressed viral load. So in Birmingham, we've added viral hepatitis, so this is hepatitis B and hepatitis C, and tuberculosis to the programme of work as they can be co-targeted with HIV. And the addition of these is why it's called the Fast Track Cities Plus initiative in Birmingham, not just Fast Track Cities. So the whole of Birmingham has signed up to the Fast Track Cities Plus initiative, not just the City Council. So we've got partners at University Hospitals Birmingham and then charity organisations, CGL, Hep C Trust have all signed up to this initiative, not just the council. And these are the main aims of it. It's to ensure the availability and access to testing and treatment. We aim to strengthen communities to support them without prejudice and stigma. And we aim to ensure the necessary interventions are in place to enable us to reach our targets, which are on our website if you want to have a look at them. So what have we done so far? So in December 2020 to March 2021, we underwent a tender process to get a provider to conduct a community engagement and needs assessment. Then April to August was the data gathering for this piece of work. September 2021 to May 22 was the write-up of the report. And then from May to October, we were finalising the targets for the initiative. So this included scoping what data was available, how we were currently performing, and what we thought were achievable targets by 2030. And then in October 2022, we signed the Paris Declaration. So there's the Lord Mayor of Birmingham and Tanya Dipfeld, who's the Regional Director for Fast Track Cities Europe, with the signed Paris Declaration, meaning that we officially commit in Birmingham to the initiative. And then May 2022 to present, we're developing the action plan for the next phase of the project. So a big part of the action plan is raising awareness, encouraging people to get tested and reducing stigma. So first, I'd like to start with a quiz to see how knowledgeable you all are about TB, HIV, hepatitis B and hepatitis C. So if you open up menti.com and enter the code 2678375, and then Dawn's going to share the quiz now. So you can see the code at the top there. And to give you a clue on the first one, HIV, hepatitis B, and hepatitis C are all known as blood-borne viruses, BBVs. Yeah, if you open up Mentimeter and enter the code. So we've got about 23 people on this call, so wait until we've got a few more responses. Wait until we've got one more maybe, and then reveal the answer. Okay, so that was actually a bit of a trick question to start. It's actually found in all of them. So yeah, it's found in blood, vaginal secretion, semen, and breast milk. On to the next question. The next question is, what is the most common way that HIV is contracted in the West Midlands? Is it through heterosexual contact, sex between men, or all other exposures combined? So this includes breastfeeding, injecting drugs, among others, or unknown exposures. So this is where the individual hasn't disclosed how they might have contracted HIV. So we actually got quite a split response on this one. But yeah, it's the answer that the majority all keeps changing. So yeah, it's through heterosexual contact is the most common way that HIV is transmitted in the West Midlands, and it's been that way for quite a few years now. It's something that often people don't know, bit of a myth sort of around the way that HIV is contracted and passed on to people. Which organ in the body does hepatitis B and hepatitis C infect? Is it the kidneys, the liver, the pancreas, or the small intestine? So yeah, overwhelmingly got the same response from everyone for that one, and you're all right, it is the liver. Anything with hep at the start tends to be liver related. So is tuberculosis a viral or a bacterial infection? Yes, the majority have got that right. It's a bacterial infection. So unlike HIV, hepatitis B, and hepatitis C, which are all caused by viruses, TB is a bacterial infection. So is this statement true or false? There's no risk of HIV transmission when a HIV positive partner's virus is suppressed to undetectable levels with successful treatment. Yes, the majority of you are correct again on that one. It is true. If you're on effective treatment and your virus is suppressed to an undetectable level, it means that there is very, very little risk, almost no risk. It's 0.0000 something risk of transmitting it onto a partner. Can hepatitis be cured? And if so, can you become infected again with it? So the options are it can't be cured and you have the infection for life. It can be cured and after this you cannot be infected again, or it can be cured but you can be infected again. So yeah, again, the majority of you've got this right. So Hep C can be cured, but you can become infected again, which is why it's really important to reduce your exposure to the virus um, after you have been infected, especially as the treatment gets it less effective over time. So the more times you're infected with Hep C and on the course of treatment, the less effective the treatment is likely to be. So which of the below is there a vaccination to protect against? You can choose more than one. Is there a vaccination for HIV, Hep B, Hep C, TB? Okay, so there is a vaccination for hepatitis B and TB. There is currently no vaccination for hepatitis C or for HIV. So who with tuberculosis is infectious? Anyone with the infection who's displaying symptoms, anyone with symptoms and bacteria in other parts of the body, so the kidney or the spine or other areas, or anyone with symptoms and the bacteria in the lungs or throat. We've got a bit more of a split on this one, but the correct answer is anyone with symptoms and the bacteria in the lungs and throat. This is because people can have latent TB infection, whereby they're not displaying any symptoms and they're not infectious. What does U equals U mean? So you can choose more than one for this. Does it mean undetectable equals untransmittable? Does it mean treatment has reduced your viral load so you cannot pass HIV on? Is it treatment as prevention, or are you not sure? This was a bit of a trick question from me. It does mean undetectable equals transmissible, and the meaning of that is that treatment has reduced your viral load so you cannot pass HIV on. Therefore, treatment works as prevention because if you can't pass it on to other people, you're preventing giving it to your partners. So what percentage of people living with hepatitis C develop symptoms? 10 to 20%, 20 to 30%, 40 to 50%, 70 to 80%, 80 to 90%. So the answer for this one is actually 20 to 30%, which is why it's really important to get tested because you might not necessarily feel unwell, but if you could be at risk, yeah, you could be at risk without knowing. I think that might be all the questions on the quiz. So well done, everyone. You can give yourself a score out of 10. There were 10 questions there, and I hope you learned something new from that. Now I'm just going to go back to the slideshow. Yeah, so I'm going to go through each of the infections one by one. So talk about HIV, then hepatitis B, then hepatitis C, and then TB, hopefully leaving some time for some questions at the end. So firstly, HIV is a retrovirus which attacks, infects, and destroys cells of the immune system. So over time, it weakens the immune system, leaving people more vulnerable to other infections. In the UK, the most common way of contracting HIV is through condomless, anal, or vaginal sex with a person infected with HIV. It's important to remember this is a person infected with HIV who is not on effective treatment, so does not have a suppressed viral load. The other main ways of contracting HIV in the UK are associated with drug use and from mother to baby during pregnancy or breastfeeding. The symptoms can be a flu-like illness, or often somebody living with HIV displays no symptoms at all. Untreated HIV can progress, meaning that a person is more at risk of a serious AIDS-defining illness. It's really important to note the progress that has been made over the years, which now means that somebody living with HIV on effective treatment can live a long, healthy life and have an undetectable viral load, which means they cannot pass it on to their partners. So HIV in Birmingham, this graph on the left shows how we're doing in terms of meeting the 95, 95, 95 targets I was talking about earlier. So you can see in the purple bars that in 2021, it was estimated that 95% of people living with HIV were diagnosed with HIV. 100% of people diagnosed with HIV were on treatment, which really shows kind of how good our HIV service is here in Birmingham. And then 98% of people on ART had a suppressed viral load, which means they can't transmit it onto their partners. So it seems from that graph on the left like we're doing a really good job at meeting the 95 targets. However, when we look on the right, we can see the continuum of care model. So if we take the 100% of people estimated to be living with HIV, as mentioned, 95% of those are estimated to be diagnosed with HIV, which then means that 94% of people living with HIV are on treatment and 92% of people living with HIV have suppressed viral loads. So this therefore means that 8%, it's estimated that 8% of people living with HIV do not have a suppressed viral load and therefore are still at risk of passing it on to partners, which is why it's really important that we drive up testing and people get tested for HIV. So this shows the kind of epidemiology of HIV in Birmingham. So as you can see on the map on the left, we've got higher prevalence rates per 1,000 of the population in the centre of Birmingham and in the south of Birmingham, with lower rates of HIV in the north of Birmingham. In Birmingham last year, 43% of people living with HIV were diagnosed late or very late. This means there's more time for them to be able to pass this on to their partners as they wouldn't be on treatment. It also means that the treatment is less likely to be as effective. These late diagnoses are also very unequal in terms of who is receiving late diagnoses. So they're more common in heterosexual men and Black Africans, which is why it's really important that all populations are getting regularly tested for HIV. Now, Dawn's going to talk a little bit about how we can prevent the spread of HIV and how we can get tested for it.
A condom is the most effective form of protection against HIV and other sexually transmitted infections. Free condoms are available through the Umbrella Sexual Health Service in Birmingham, Umbrella Health. It is important not to share needles, syringes, injecting equipment such as spoons and swabs, or the actual drugs or liquids used to dilute them. If you are HIV negative, you may be able to take PrEP medicine to reduce your risk of getting the virus. PrEP is available from Umbrella Sexual Health Services to people who are at high risk of infection. If you have had sex with someone who may be HIV positive, you can reduce chances of HIV infection by taking Pepsi within 72 hours of having exposure to the virus. To get Pepsi, visit Umbrella's Whittle Street Clinic during opening hours, of course, or the A&E department as soon as possible after potential exposure. Next slide, please, Lottie. You can order a free online test from HIV Prevention England portal. There's a link there. Self-sampling kits from Umbrella Sexual Health. There's a link there too. Umbrella Sexual Health Clinics, CG and Hepatitis C Trust, or your GP. We've already mentioned that there are a high number of late diagnoses, which is why testing for HIV is so important. This week is HIV testing week, which means you can order a free testing kit from the HIV Prevention England portal. Juliet is now going to put the link into the chat now. Thank you, Lottie. Over to you.
Yeah, thank you, Dawn. So now I'm going to talk a little bit about hepatitis B. So hepatitis B is a liver infection which is caused by the hepatitis B virus. It's also sometimes called Hep B or HBV, so you might have heard of it being called either of those things too. Usually an infection with hepatitis B only lasts a few months, and most people do not have any noticeable symptoms. However, if it lasts more than 6 months, people are said to have a chronic infection. So this requires treatment to slow the progression of liver damage and reduce the risk of liver cancer. So the risk of contracting Hep B in the UK is fairly low. However, it's a lot higher in Africa, Asia, the Middle East, and Eastern Europe. Ways in which you can contract Hep B include, so the majority of people acquire it during childbirth or as a young child from close contact with those infected with it. However, you can also contract Hep B from sex without a condom, injecting drugs using shared needles, and having a blood transfusion for Hep B or any other kind of medical treatment that involves blood products that have not been screened for hepatitis B. So since 1991, blood transfusions in the UK have been screened, but if you've had one before then, it might not have been screened for hepatitis B, or if you've had medical treatment abroad, it's possible that it's not been screened either. So the epidemiology of hepatitis B in Birmingham. So this graph on the left, well, map on the left, is from the Queen Elizabeth Hospital Viral Hepatitis Service internal data. As you can see, it is quite old. It is from 2007. However, the same picture still applies today with the data we have access to now. As you can see from the values on the left, Birmingham has a higher hepatitis B incident rate compared to the England average. So it's 0.97 per 100,000 compared to an England average of 0.69 per 100,000. You can also see that within Birmingham, this has a very unequal geographic and ethnic distribution. So we've got a lot higher numbers in the east of Birmingham, and these tend to be in people from South Asian populations, account for the highest proportion of those diagnosed with Hep B. We're also trying to drive up the childhood hepatitis B vaccination coverage in Birmingham, as in 2021 to 2022, we had a 94.5% vaccination coverage. Now I'm going to pass back to Dawn, who's going to talk a bit about how we can prevent Hep B and how we can get tested for it.
Thank you, Lottie. Vaccination is the best way to prevent hepatitis B. In the UK, the hepatitis B vaccine is given to babies as part of the 6-in-1 vaccine. Babies born to mothers with hepatitis B are given additional vaccinations at birth, 4 weeks, and 1 year to reduce the risk of them getting the infection. Adults should get the hepatitis B vaccination if they are at high risk, for example, travelling to a high-risk country, have liver or kidney disease, are living with HIV, have a job that puts them at risk of infection, for example, healthcare workers or those who work in a prison. The employer should organise vaccination at an in-risk occupations. Individuals can also reduce their risk at contracting hepatitis B through using a condom or dam when having vaginal, anal, or oral sex, and avoiding sharing razors, toothbrushes, and needles with others. Next slide, please, Lottie. Dry blood spot tests for all 3 diseases. Testing for hepatitis B is really important. In the first 100 days of opt-out testing in A&E in London, Manchester, Brighton and Blackpool, a staggering 328 new cases of hepatitis B were found, which really is a lot of people who probably would not have been tested for it otherwise. Certain groups who are at a higher risk of hepatitis B can access free testing through the Umbrella Sexual Health Service. GPs, Change Grow Live, and the Hep C Trust all offer testing for hepatitis B. Over to you, Lottie, thank you.
Thanks, Dawn. So hepatitis C is another liver infection, and it's caused by the hepatitis C virus. Similarly to Hep B, it also can be called Hep C or HCV. It's most commonly spread by injecting drugs using shared needles or being injured by by a used needle. In many parts of the world, though, it can be passed on through reuse or inadequate sterilisation of medical equipment and transfusion of unscreened blood. So similarly to what I was saying with Hep B, blood in the UK has been screened for Hep B and Hep C since 1991. However, this might not be the case if you've had medical treatment abroad or received a blood transfusion before 1991. It can also be transmitted through pregnancy and childbirth and through sexual practices. But unlike Hep B, these are far less common methods of transmission. People living with hepatitis C often have no symptoms at first, and these symptoms can be mistaken for other conditions. They commonly include feeling constantly tired, joint and muscle pains, nausea, brain fog, mood swings, mental health problems, indigestion, and abdominal pain. If left undiagnosed and untreated, the virus causes ongoing liver damage, which can lead to liver cirrhosis and liver cancer. However, hepatitis C is treatable. It's now a lot better treatment than it used to be. It's a short course of tablets, lasting between 8 to 16 weeks. This treatment tends to cure 90% of people living with hepatitis C, but they do need to minimise their risk of becoming reinfected as the treatment is less effective each time. So the epidemiology of hepatitis C in Birmingham, as we can see from this graph, if we compare it to the hepatitis B one, it's got quite a different demographic profile. So the majority of diagnoses are in Caucasian populations, with fewer diagnoses in Asian populations when compared to hepatitis B. In 2021, 268 people in Birmingham and Solihull received a first known positive Hep C diagnosis. So these are people who weren't already aware that they had the infection. Out of these, 51% of eligible people with current Hep C diagnosis have started treatment in Birmingham, and 69% of injecting drug users report adequate needle and syringe provision to meet their needs. Dawn, who's going to talk a bit about Hep C prevention and testing for Hep C.
Thank you, Lottie. Unlike hepatitis B, there is no vaccination for hepatitis C. Individuals can reduce their risk of hepatitis C through not sharing any drug injecting equipment with other people, including needles and other equipment such as syringes, spoons, and filters, not sharing razors or toothbrushes that might be contaminated with blood. Next slide, please, Lottie. A blood test is carried out to see if someone has hepatitis C. GPs, Change Grow Live, and the Hep C Trust all offer testing for hepatitis C. Testing for hepatitis C is important because it often has no symptoms. Therefore, early diagnosis and treatment can help prevent or limit any damage to the liver and help ensure the infection is not passed on to other people. Back to you, Lottie. Thank you.
Thanks, Dawn. And now I'm going to talk a little bit about TB, which is the final infection which the Fast Track Cities Plus initiative aims to target. So TB is a bacterial infection. There are two types of TB infections. So you've got TB disease, so that's active TB. And then we've also got latent TB infection. So people with latent TB do not have symptoms and it can remain inactive for their whole life. However, it can cause disease, particularly when people's immune system is weakened. TB is transmitted through inhaling tiny droplets from coughs or sneezes of an infected person who has active TB present in their lungs or throat. It predominantly affects the lungs of the infected people, but it can also infect other parts of the body, including glands, kidneys, bones, and the nervous system. Treatment with antibiotics is effective, and it's usually recommended in those who are under 65 years old. However, the treatment can cause liver damage in older adults, hence why it's not recommended in people over this age. Multi-drug resistant TB is quite rare in the UK, however, it still does occur. So this is where the bacteria has mutated to the point that antibiotics are no longer effective at treating the infection. This is why it's really important that if you're ever prescribed antibiotics for any type of infection, that you complete the full course, because this helps to reduce the risk of getting drug-resistant, antibiotic-resistant diseases spreading. So tuberculosis in Birmingham, the TB incidence in Birmingham, as you can see, is a lot higher than the England average. From 2018 to 2020 in Birmingham, it was 18.4 per 100,000, whereas the England average was only 8 per 100,000. And in 2019, 86% of individuals with drug-sensitive TB in Birmingham completed treatment within 12 months of their treatment start date. So this is better than the England average of 82%. In terms of preventing TB, there is a BCG vaccination which does protect against TB. It's recommended for babies, children, and adults under the age of 35 who are at risk of TB. At-risk groups include children living in areas with high rates of TB, people with close family members from countries with high TB rates, and people going to live and work with local people for more than 3 months in an area with high rates of TB. So more information about kind of the eligible populations for the BCG vaccination can be found in the Green Book as well. So testing for TB is a little bit different to testing for BBVs. So there's a latent TB screening programme which screens those who are at high risk. And there's also contact tracing procedures around testing for TB. So individuals might need to be tested if they've been in close contact with someone who's known to have active TB disease, or if they've recently spent time in a country where TB levels are high. People who've also just moved to a country where TB is common should be given information and advice about a need for testing. So in a summary of what I hope you've got from today, I hope you've got a bit of an understanding of what Fast Track Cities Plus Birmingham is, especially if you had never heard of it at all before today. Hopefully you found out something new about BBVs and TBs that you didn't know before. Hopefully you've got an understanding of why testing for BBVs is so important, and hopefully you now know where to go and direct your friends and family to go and get tested. Get tested and get treated. New for this year is very rapid postal HIV testing kits. So these are kits that can be ordered online via that link that Juliet put in the chat. They're brand new this year. It's a new type of test that's not been offered before, which is very similar to a lateral flow test that we all got so familiar with during COVID. You just prick your finger, get out a small amount of blood, and then you can get your result within 15 minutes. So you can test at home and know the result 15 minutes later, and that's for HIV. And they're available to order from that link in the chat that Juliet put in this week. So if you've never been tested for HIV before or not for a while, been with multiple partners, anything that you think could put you at risk of it, I'd encourage you to get tested. Thank you for listening, and please let me know if you've got any questions.